Hi, my name is Dragana Skokovic-Sunjic, and I'm a clinical pharmacist working in a primary care setting. In this final video of our three-part series from the AEProbio Professional Discovery Academy, made possible through an unrestricted educational grant from Align, we will discuss continuing care for patients living with IBS. Your IBS patient has returned to the clinic for a follow-up. On their previous visit, you and your patient decided that trying a probiotic to relieve the nagging symptoms of IBS would be best. After consulting the clinical guide to probiotic products, you recommended a specific probiotic brand backed by evidence to relieve and manage symptoms of IBS. So all is good, correct? As with most health issues, there needs to be an appropriate plan for a follow-up. We need to determine how successful the treatment was. We want to ask the patient how their symptoms are now. Are they still experiencing discomfort, bloating, changes in bowel frequency and consistency? Have they noticed any additional symptoms or side effects? Do they feel the probiotic was successful? Were they able to take the probiotic daily for at least 4 weeks? Ask patients if they have abdominal pain or cramping, bloating, excess gas, and flatulence, changes in bowel patterns such as constipation and/or diarrhea, abnormal stool frequency, or any unusual or bothersome side effects. Sometimes patients return to the clinic saying that probiotic was not effective. In our practice, we find that this is often not because the probiotic did not work, but because the patient did not follow our specific recommendation. They may have substituted with another brand or product containing different strains from what we recommended. Or they may not have taken the recommended probiotic daily and for at least 4 weeks and have not felt the true effect of the probiotic on their symptoms. Many patients assume that probiotics are all the same. They may not be aware of the fact that only specific strains are effective in relieving IBS symptoms. Their confusion is understandable. When patients walk into a typical pharmacy, they will see shelves full of many probiotic brands. The probiotic strain is not always clear on product packaging, so the patient may unknowingly select a probiotic that is not proven for IBS symptom relief. Also, many patients assume more strains or more CFU or colony-forming units may be better when in actuality, these do not indicate greater effectiveness at treating IBS symptoms. It is important for patients to understand why they need to follow your probiotic prescription and try the specific brand or product you recommend. If they choose a different brand than your recommendation, they might not experience relief from their IBS symptoms. There is a high probability they will continue to experience IBS symptoms that impact them at work, home, school, and in social situations. Some of the most common questions patients have are, what happens if they miss the dose of probiotics? And can they continue taking the probiotic once their symptoms are resolved? If yes, for how long? Generally, probiotics are most effective when taken daily. If they miss the dose, patients should pick up their routine the next day, but there is no need to double the dose to make up for the missed day. Patients experiencing IBS symptom relief with the prescribed probiotic should continue taking the probiotic daily so they can continue to manage their IBS symptoms and prevent symptoms from returning. Probiotics listed in the guide for IBS have been evaluated in long-term studies and are safe for continuous use. that you and your patient know how to select the trusted, safe, and effective probiotic for IBS symptom relief, your patient can enjoy maintaining a healthy life free from the experience of IBS.